Patient, consumer, and labor advocates in late January organized a community forum in Norwich to address growing concerns over the future of the Affordable Care Act. They heard from their district's representative in Washington, who reported back on attempts by the new administration in the White House and congressional Republicans to roll back the nation's signature health care law.
Immediately, the impact would be 18 million individuals would lose their health coverage in year one, and then as the Medicaid cuts sort of unfold over time, that number would grow to over 30 million. And the impact in terms of hospital reimbursement would be in the billions. This is not a partisan analysis. The director of the Congressional Budget Office was selected by the majority, by the Republican majority, Keith Hall, and that report was issued on January 17th.
Without the ACA, I wouldn't be able to stand here today. I wouldn't be able to stay on my parents' health care. I'm 21, so the ACA allowed me to stay on my parents until I'm 26, which is awesome. Also, without it, I do have pre-existing conditions that are chronic. All three of my illnesses are chronic and lifelong.
We cannot expect people to work if they do not have medical care. If their health is not good, both mental, physical, their dental health, all of those things that many of us take for granted are critical components of making a city healthy, whole, and progressive.
The plans for repeal that Representative Price and other members of the GOP are pushing are a very dangerous gamble with the health for our patients in our communities and the financial viability of our healthcare system, and not only that, but state budgets nationwide. We're concerned that patients like Jennifer, who spoke earlier, will become uninsured and that they won't get the care that they need, that they won't fill their prescriptions, and they'll be back in the hospitals sicker than before.
The fight against the bad stuff coming down from our nation's capital does not get our state off the hook to make change that will help people like you and me.
For those of you who got here early, we didn't expect this many people, so you might have gotten a sheet that says, what's your healthcare story? And it has an opportunity for you to let us know if you're interested in telling your story. It has an example of 2 stories about the ACA and Medicare. Cannot emphasize enough about the importance of that.
There are people in Norwich that really care about what's happening here. There's people in Norwich that really care about their health care. You guys are important. The only way that you and I are going to change this is through agitation, is through activation. We have to stand up for what we believe in. We have to get a hold of our elected officials. Remember, they're elected to represent who? To represent us. And we have a voice, and we need to make that voice known.
Join us to make sure Southeastern Connecticut residents don't lose access to quality, affordable care. And demand Washington politicians keep us covered.